Well, welcome back, everyone. I'm Pat Camillo, the creator and presenter for this continuing ed program. So we are in the very last section of this 3 contact hour program. And there are just 2 more brain disorders that I'd like to share some very recent information regarding their association with estrogen. The first is autism, which some may find surprising, but then again, it was in the news recently, so I thought it'd be important to touch on it. And the second one, you may or may not even be aware of this disorder. It's called borderline personality disorder, a very big gender disparity, leaning towards more women, of course. And recently, they've shown quite a bit of connection with estrogen. All right, so let's get started. I've talked quite a bit about the numerous gender disparities related to brain health, and autism spectrum disorder is another one. Only this time, it favors the male, where it's 4 to 5 times more common than in females. So you might ask, what does estrogen have to do with it then? Well, remember when I talked about brain development earlier in this program? Prenatal hormones such as androgens and estrogens are thought to influence the development of a fetus's brain. Androgens play an important role in turning that female default brain into a male brain. This impacts neural circuits that later develop specialized roles in, yep, you may have guessed it, social cognition. So this is potentially an important clue behind the symptoms we see in autism. And yet, this program of research isn't entirely new. This idea was first put forward roughly 2 decades ago. And there are several published studies that have shown that prenatal hormones, including testosterone, as well as cortisol and progesterone, are higher in male fetuses who go on to develop autism. But those earlier studies focused on androgens and not estrogen. The new research that created all the buzz recently did involve estrogen. It was done in Denmark and reported in the journal Molecular Psychiatry. You read that one, right? But this is the problem with many of these studies. No one ever reads the actual report. Instead, they follow the headlines, and in this case, those headlines were saying that estrogen was found to be a cause of autism, which of course is not true. So what did the research actually conclude? It provided the first evidence that prenatal estrogen levels may be more predictive of autism than even androgens. Being predictive and being causative are not the same. When it comes to autism, genetics also plays a role, and it's entirely possible that there's an interaction between certain genes and estrogens that can affect the developing brain. We're just going to have to wait for the research to develop these ideas further. Now, as you look at this slide, I bet you're wondering what zebrafish have to do with autism and estrogen. Well, let me tell you a little about this tiny fish that are in so many home aquariums. They're even more amazing than mice and rats for research. A female can lay several hundred eggs, and you can have lots of adults within just 3 months. They're pretty easy and cheap to keep. They live on brine shrimp in fresh water, and they can survive for years. And because they're almost completely transparent, scientists can study all kinds of changes and effects without ever needing to even touch them or manipulate them. If that's not enough, get a load of this. 70% of our human genes, it turns out, have a counterpart in the zebrafish. Their genetic structure is surprisingly close to ours. Who knew, right? Next time you see an aquarium with some zebrafish, or if you have some at home, you have to give them a nod. There are all kinds of amazing research being done with these little fish. It's pretty easy to mute their genes just by adding some chemicals to their water, and then scientists are able to study specific mutations and possible remedies for them. All right, well, my excitement over learning about these little fish has caused me to drift from the focus of this section. So what do they actually have to do with estrogen and autism? Well, scientists found that when they gave hyperactive little zebrafish estrogen, it had a calming effect during the night. Interestingly, the researchers found that not only was estradiol effective in reducing hyperactivity, but also an isoflavone called biocanin A. Now, this is an isoflavone that's in the same family as soy products and other legumes that have an estrogenic effect. This research is very early, but really interesting. It'll be years before it reaches humans. But on the other hand, there's no risk to adding a few extra legumes in the diet if hyperactivity is an issue. And the last condition I'll cover is called borderline personality disorder, or BPD. According to the National Institute of Mental Health, it's a mental illness marked by an ongoing pattern of varying moods, self-image issues, and behavior problems. People with borderline personality disorder often experience intense episodes of anger, depression, and anxiety that can lead or last from a few days or to a few hours. Recurrent thoughts and behaviors related to self-injury or suicide are also quite common, and approximately 10% of people with borderline personality disorder die from suicide. So it's a pretty serious brain disease. And guess what? There's a huge gender disparity once again. Women are far more likely to be diagnosed with BPD than men. In fact, about 75% of people diagnosed with BPD are women. And now that's a ratio of 3 women to 1 man. That's really a disparity. This is another one of those neatly boxed mental health diagnoses that never really made sense to me. It's considered a personality disorder, and because of that, many times therapy is not even covered under many health plans. But in fact, women who are branded, and I say branded because I'll tell you in a moment, with this diagnosis are often experiencing severe and chronic mood instability. But they also then have to deal with the shame and stigma of not having a, quote, real mental health disorder, but rather one that has to do with their personality, which can easily be translated into, there's something wrong with me as a person. Now remember, suicide is a high risk for these women. But if you think about it, what do you know about the symptoms of anger, depression, and anxiety now? Where do they come from? It certainly wouldn't be far-fetched to consider an estrogen connection, right? And yet there's been so little research in medicine, most of it in psychology, because honestly, they must have lots of clients that fit the criteria for this diagnosis. That's not to say that there isn't value in using cognitive behavioral therapy, for example. There certainly is. But that's not in an attempt to reshape someone's personality, but rather to lower their stress levels, which you now know are interrelated with cortisol and estrogen and will certainly affect mood. So there's some beginning evidence for this connection between estrogen and BPD. Researchers at the Illinois College of Medicine are exploring whether there are changes in symptoms experienced by women during their menstrual cycle. And in fact, they found that the symptoms got worse by at least 30% during the perimenstrual phase of their cycle. That's quite a bit, and similar to the change that one might calculate occurs when going from moderate to extreme depression. This included the week before and during their menses, when estrogen levels were low. If you take a look at the graph on the slide, the dotted line represents those who had only a few symptoms of BPD. The middle line had high traits for BPD, and the top line had really high traits. On the lower left, estrogen levels on the lower left, estrogen levels are lowest, and on the right, estrogen levels are highest. And the vertical axis is basically looking at symptoms. So clearly these women with very high traits for BPD had the most symptoms, and notably at a time in their cycle when their estrogen levels were at their lowest. This is the largest prospective study examining cyclical mood changes in patients with BPD to date. It was published in the journal Psychological Medicine. Now, it's not uncommon for women who complain of menstrual-related mood issues to be prescribed an oral contraceptive to help stabilize their hormones and hopefully avoid the peaks and drops that contribute to mood instability. And sometimes this does help, but it's a crapshoot. Take a look at another slide from our colleagues in Australia. Using OCs can be problematic when trying to stabilize mood. Some women with depression will get worse if given a low-dose estrogen pill. This should make sense to you now as we get closer to the end of this program, given what you've learned. I've seen many women improve on a pill, like Yasmin, for instance. However, drospirenine, which is the progesterone in Yasmin, can actually make aggressive behavior worse. Most progesterones really don't help mood, and often it'll make it worse, and especially so with progesterone-only products. Now, on the surface, you might think that multiphasic OCs would be better, but actually they're even worse for mood than monophasic OCs. There is, however, a birth control pill that might prove very effective for mood, but could have side effects that lead to acne and weight gain. That OC is called Zoeli, and I'm not entirely sure if it's been approved here in the U.S. yet. It's interesting because instead of the synthetic estrogens found in all of our oral contraceptives, this one uses 17-beta estradiol at 1.5 milligrams. So that's a really big difference. To the best of my knowledge, I did look around. I couldn't find anything that says otherwise. This probably is not FDA approved yet in the U.S., and I'm not sure it ever would be. It appears to be available, however, in Australia and Europe, including Scandinavia. But even there, I actually read recently that Sweden and the UK are having supply issues, making it difficult for women who've been using it to refill their prescriptions. So, what's the bottom line? We still don't have a good OC that can reliably, in most women, help with mood instability. I have one other thought to share about all of this, specifically about BPD. Take a look at this slide. This shows many of the comorbid conditions that often coincide with a diagnosis of borderline personality disorder. Pretty impressive. So, are these all distinctly unique brain diseases, or are they symptoms of one overriding common pathology? What do they have in common? Now that you almost completed this program, do you have a sense that estrogen is a pretty significant piece to this puzzle? It took years for the psychiatric community to recognize the biochemical basis for the symptoms associated with many of these conditions. But there's still so much more to understand, especially about BPD. I'm happy to see more and more psychiatrists broaden their perspective to include estrogen and other hormones, but not nearly enough of them. It's a very slow process bringing them over because, well, some are a little stuck in their psych box. But I'm hopeful. I see it with the folks in Australia and here at the University of Illinois as well. So in this last slide, I listed the sections covered in this educational activity and thought it might be helpful to just highlight some of the core content that was covered. First, with a better understanding of how the HPA and HPG axis interconnect, we can better understand how low levels of estrogen are going to make us less able to handle chronic stress and how it can even affect fertility. Recognizing that estrogen is independently produced in the brain broadens our understanding of this hormone that takes us well beyond reproductive functions, especially when considering the large number of estrogen receptors found in just about every brain region. With a better understanding of how estrogen interacts with and modulates so many of our neurotransmitters, there's a much better insight into the role it plays specifically in anxiety and depression. And with an ever-aging population and the increasing risks for Alzheimer's disease, appreciating the critical role that estrogen plays on cognition is going to be so important as we try to be proactive in preventing dementia. The stunning possibility that estrogen might be an important adjunct treatment for schizophrenia, a terribly disabling brain disease, provides hope as we move forward in better understanding the biochemical basis for this awful disease. Other brain diseases such as autism have been also found to have some potentially important connections to estrogen that could open the door to a better understanding of the pathology involved. And last but not least, a different perspective on borderline personality disorder, one that is more grounded in physiology, will hopefully help to diminish some of the stigma associated with not only BPD, but also many of the brain diseases and symptoms I discussed in this program. Given that these conditions are much more prevalent among women, it makes sense to look at some of the obvious gender differences, and of course, this includes estrogen. So I hope you enjoyed the program and learned a lot. I hope that you will help disseminate this information because having all this good knowledge needs to be shared. Share it with your colleagues and even your neighbors or whoever you happen to meet and be chatting with. Knowledge can really make a difference. So thank you, and don't forget to complete your evaluation form to get your contact hours and also to give me some idea of what you thought about the program and what programs could be interesting for you in the future.